Well, when I first saw it, I was utterly shocked at how strong the message was. The phrase which sprung out to me after watching it was emotionally manipulative. In the strongest emotionally manipulative piece of communication and propaganda that I have seen so far. I mean, it was absolutely incredible, really.
Hi, well, welcome, Damian. Thank you for finding some time to speak today. I think the main topic we'd like to focus in on today to do with the ethics of the treatments that are being proposed for COVID. This is something we'd like to sort of focus in on with your expertise. And just by way of introduction, so we got together, I guess, through contacts in the HART group, and you're a member of the HART group that's done, I would say, fantastic work in really identifying the science around the COVID response. And I think on many themes, the HART group has a different view to the government, and you've put out some excellent research on every single topic around COVID. And your particular specialism was on the way the messaging is done, which is something we'd like to focus in on today. And I'd let you sort of introduce yourself, if that's okay.
Yeah, absolutely. Well, good to be here, Alex, and thank you for inviting me on. So, so my name's Dr. Damian Wilde, Damian. So I'm a highly specialist clinical psychologist. I currently work for the NHS in adult mental health. Sort of early on in my career, I was originally a primary school teacher, and then I went on to work in child and adolescent mental health services, sort of prior to completing my clinical psychology doctorate. In my current role, I provide sort of specialist assessment, teaching, supervision, but my main specialism is trauma psychotherapy, sort of with a primary emphasis on using psychodynamic psychotherapy. So that's sort of my day-to-day work that I use. You were mentioning there the HART group, so I'm a key member of that group. So we're sort of a group of scientists, doctors, medics, academics, and clinical psychologists. And we've sort of come together to sort of gather evidence and sort of present it in a calm and compassionate manner. We compiled a COVID evidence booklet, which I believe is linked on the slides, but also we do weekly bulletins, which are sent to MPs. So we're just trying to highlight what we feel certain things could be done differently, the impact of certain COVID strategies, and what we think would be more effective. So we're a sort of true multidisciplinary team. And like you were saying as well, sort of my role on that team and in a wider scale is focusing on the psychological impact of sort of COVID messaging and COVID strategy. So that's kind of my role within some of what's going on within HART and outside of that as well.
So I think maybe if we go through some of the bigger points, I mean, I think the first point we can start with is the use of emotion on the population. And I think most people now understand the use of fear, essentially, that has been a sort of a tool used to increase compliance. And maybe start with that, the sort of population level. You know, what do you think on an ethical perspective about the use of fear to increase compliance?
Yeah, well, you make an interesting point. It reminds me of a colleague of mine, Dr. Gary Sidley, who said a frightened population is a compliant one. And, you know, not just around vaccines, but right from the very start with regards to lockdowns and all the restrictive measures that the government are wanting to put into place, is that they've used fear as a means of trying to get the public to become as compliant as they can. So we do know that obviously SAGE advised the government, but within SAGE, there's a team of behavioural scientists who communicate what they think will encapsulate sort of the public's minds with regards to helping them to comply as best as they can to the government strategies that they want to put into place. Now, it's okay if this is educational and informational, but it's been absolutely sort of put forward in a very aggressive and forceful manner. You know, every TV that you turn on, there's a message. Every radio station that you turn on, there's a message. Every website, every shop you go into, there's a sign. Every railway station there's a sign. There's some sort of sign to try and make people feel as fearful as they possibly can, and even guilty if they're not complying to the kind of various you know, measures which are in place, or uptake of vaccine. So it's completely unethical, and it's caused a lot of people a lot of emotional and psychological distress.
Yeah, I guess the thing we'll get into is the case that they're doing it for your own good, and therefore, you know, they'll argue that it is appropriate to do that because it's for your own good, and I guess that'll be the topic we'll sort of unravel during this discussion. So moving on maybe from there into the specific area of treatments, and you know, we can I think we can go in a little bit into the vaccine part, and I think you wanted to start with something on, you know, how the messaging is targeted at young people and the ethics of that, basically.
Yeah, I think we can see from one of the slides some an NHS sort of informational message, which is to do with instructing you know, different places, whether it be schools or NHS places or different kind of places which might have contact with young people, ways in which to persuade them, okay, ways in which to influence them. All right, so like, you know, for example, if you look at one of the slides which has that message on, it talks about highlighting sort of things that young people may miss, okay, if they don't get the vaccine. Okay, so reminding them about, you know, pleasurable things like engaging in sports and going on social events and seeing friends. So the government and the NHS are trying to push the message across, really, that if you don't get the vaccine, you may miss out on certain things that you find pleasurable. So obviously that's unethical because it's playing on people emotionally and psychologically. We can also see that through, on one of the other slides, we've got that poster, the NHS poster, which highlights things like, you know, dodgy haircuts, you know, virtual happy hour, but then crosses out the dodgy, crosses out the virtual. I think it's online shopping on there as well. Online is crossed out. And I think there's a message at the bottom saying, let's not go back to this. So again, it's making people feel as frightened as they can, that these things which keep them well, so these are all self-care aspects which people need to feel psychologically well. So if someone, okay, suggests that these may be taken away, people are going to feel frightened, okay? People are going to feel scared that the things which help them to function psychologically are going to be taken away. So essentially, some people, I think, are being scared into taking the vaccine. Now, vaccines are important. We've had other vaccines in use, but it has to be weighed up for each individual, and each individual should be able to make their own choice. Okay, so informed consent is absolutely essential and good ethical practice. What we can see through various posters, through various behavioural strategies kind of being put forward, is that people are being influenced, people are being pressured, and people are being emotionally and psychologically manipulated If you even look at the NHS's own informed consent document, which is freely available on the internet, it clearly states that true informed consent should not show influence or pressure from other people when someone's making a decision on healthcare.
Okay, so Damian, then the informed consent from the NHS, I read the guidelines. They're very, very strict. I mean, I'm surprised how strict they are. And I just wanted to ask you, I was kind of surprised by this one, that, I mean, basically, this is straight from their consent form, talking about, you know, it has to be voluntary. This is still the case, even if refusing treatment would result in their death. Which is, I find amazing. So the idea of consent is so strong that you're entitled to consent to basically not consent to treatment, even if the consequences are so serious for you. So it's a very sort of fundamental decision that you're authorized to take on your own behalf, basically.
Yeah, as long as you've got capacity. Okay.
Yeah.
So that is also mentioned on the consent document. As long as someone has capacity, and capacity is all connected with whether someone can understand the information, what is in front of them, whether they can weigh that information up and then come to a decision. Okay. If someone doesn't have capacity, then, you know, best interest can come in. But if people do have capacity, okay, then they should be allowed to make an informed choice. So consent is absolutely fundamental and ethical in, you know, NHS clinical and healthcare practice. But what we're seeing frequently, I mean, it's really incessant at the moment. You know, every email that you open, every shop that you go in, there's a post. Every railway station, everywhere that you go, there is a poster or some style of communication trying to influence your decision to take the vaccine. Okay. I mean, I've had personally myself 4 letters from the NHS, several text messages, constant emails. So the aggressive level of communications is very, very incessant. And I think it's okay for there to be educational and, you know, informative campaigns where they say, look, this is the vaccine, it's really important, we feel that people take this, it's available at these places for you to take. So informational, educational is absolutely fine, but what they're clearly doing is trying to influence and coerce people into taking it, and that's unethical.
I mean, one thing you see quite a lot is that's sort of diluting the idea that it is your decision. So you should be doing something for somebody else, basically, and you're misbehaving in a way if you actually exercise your sort of Nuremberg Code informed consent rights that you decide for yourself. I mean, they're sort of diluting the idea that you are yourself and that you actually need to be making decisions for some other consideration. How does that fit?
I mean, I think you often see the messaging, don't you? Protect yourself and protect your loved ones. That is often a phrase which is used, loved ones. Okay. So I think they're taking it out of a sort of self-decision. They're trying to spread this sort of idea that everyone should be completely altruistic and you know, get the vaccine to help protect other people. Now, of course, being altruistic and helping others is, you know, fundamental to our society. It's something I do myself in work, in and out of work, all the time. I give to other people because I'm in a position where I'm able to do that, and I happily do that. And it's absolutely a privilege to help others. But if someone weighs up the decision themselves and decides that for them personally, you know, medically, psychologically, that they do not want to get the vaccine, then that decision should be respected. And someone shouldn't have to get a medical treatment, a vaccine, just to supposedly help someone else, that they might help someone else. Okay, so they're really pressing that area. I agree with you in terms of it's not just about yourself, it's about other people. But that's kind of psychologically leaning on people because they start to feel guilty. Or maybe I should get it. I don't want to get it, but maybe I should get it because the government, the NHS message, the media message is that I get it for the greater good of society. So that is also unethical. I mean, not just this area, but the whole of the kind of COVID strategy is seeing some really unscrupulous, unethical behaviour, and it's quite shocking, really. And it's very blatant, and nothing seems to be done about it. It seems to be just accepted as okay by the people in power.
Yeah, that is surprising. If you actually read the NHS guidelines, it's nothing like what we see as the public consuming this. It's night and day, essentially, between what they're actually doing and what they're supposed to be doing, it looks like.
Yeah, well, exactly. I mean, if you use my job, for an example, is I might suggest to someone that a psychological intervention could be beneficial for them. Okay, so I can communicate that information. Okay, but I couldn't work with someone unless I'd gained consent, and that has to be informed consent. If I was seen to be leaning on people saying, you must engage with this psychological intervention, not only for yourself, but think of the people around you, think of the people that you lived with. It's going to benefit them as well. If I continually email these people, phone them up, and sent them, sort of persuasive kind of communications, and I constantly did that, then that would be deemed sort of unethical practice, and I wouldn't do that. I would give the information and say, this could be beneficial for you, but it's up to you.
Mm-hmm. I mean, if it's okay, we can watch this short video, I think, because that packs in quite a lot of these techniques, right?
Yeah. Okay.
Let's try and put it. Let me just try and put it on here, and then we can pick up the first minute or so.
Dear mums and dads,
grandparents,
aunties,
uncles,
brothers,
sisters,
nephews,
nieces, sons,
daughters,
cousins, we love you.
We know we don't say it often enough. And sometimes we have our disagreements like families do.
But wherever you are, we love you from the bottom of our hearts. And we know you love us.
And we want to see you again. COVID-19 has kept us apart for way too long.
We want to hug you. We want to celebrate with you. We want to worship with you. We want to play video games with you, preferably in the same room, so that we can see the look on your face when we beat you.
But in order to do all that, we all need to take the COVID-19 jab. So all of us in this together.
Things will slowly get back to normal. Well, what they're calling the new.
So, I mean, in that short video, I mean, I picked up some of those similar things that you were talking about, that it's, the carrot being offered is the access to your loved ones and love. And in order to have that carrot, you must get the vaccine. And also the message that, if you don't do it, you're odd in some way, and everyone else is doing it and you're not doing it. And again, the message of you should be doing it for somebody else, essentially, and you shouldn't be weighing up, pros and cons yourself. I mean, how would you see what was in the video?
Well, when I first saw it, I was utterly shocked at how strong the message was. The phrase which sprung out to me after the watch it was emotionally manipulative. In the strongest emotionally manipulative piece of communication and propaganda that I have seen so far. I mean, it was absolutely incredible, really. And like you're saying there, there's this message around, if you don't get the vaccine, things will be taken away from you. This is a breach of people's human rights. Okay, people have a right, remember, to express how they feel. Okay, that is a basic fundamental human right. And if someone expresses that they do not want to get a vaccine, right, and they're armed with all the information, that should be respected. Okay, so again, what you're picking up on as well is, I think there's this shame which is being put out there and floated around so that it kind of ripples throughout the public. Okay, and shame is a very strong psychological feeling. So they're kind of trying to create feelings of shame upon people so that then they're coerced and influenced and pressured into taking the vaccine. Now, a lot of people, you know, might find that the vaccine, in terms of having that, is really important for them. And they, you know, if they feel that, absolutely give them the information that they need to be able to take that. Because as we said, vaccines are really, really important. But what is also really important is ethical informed consent. And that's what we keep going back to. That is at the cornerstone of all of this. And that's not being respected. So I think as well, they've used celebrities in that video, haven't they? Which I suppose it's trying to enhance, you know, the connectivity with the messengers in terms of, you know, oh, well, they're well-known, important people. So, you know, if they're doing it, maybe I should as well. So it's clearly, you know, done to try to further influence people, not just the messages, but the messenger as well.
Yeah, I also noticed that it's mainly celebrities, and there are quite some important doctors out there. I mean, including some in the HART group saying, you know, we need to be careful with this vaccination, and but there's none of that in this video. It's all sort of one thing, just do it, essentially. Is I think it actually says get the jab. You know, the end of this is an instruction, that there's no risk, no mention of risk at all.
Yeah, and I think with any kind of vaccine or medical intervention is that, you know, there may be some form of risk involved, side effects, you know, short and long-term adverse reactions. So that's the other element around informed consent, which appears not to be getting carried out properly. So we've talked about the pressure and the influence which is being put upon people, which breaks informed consent. But the other aspect of informed consent is that people should be given the full information about a treatment, which also includes risks, side effects, short and long-term adverse reactions. So there are clear question marks about whether enough information is being given to people. Like you said, there was no balance with regards to any information about possible side effects or short and long-term adverse reactions. I don't think they have data on long-term adverse reactions yet. So that also brings into question about, is it truly informed consent? Because not enough information is being given. I mean, I'm sure place to place differs. I have heard of, you know, some vaccination centres where, you know, informational leaflets are given. And I think that's really important. So if that's going on in some places, that's really good to see. But I think, you know, I've heard stories from other people where they've just gone in, it's a case of roll up your sleeve, you know, jabbed, out. Okay. Now, I mean, really, there should be a consultation with each and every person. You know, okay, let's have a think about your medical history. You know, does this seem the right thing for you? Okay, there's none of that. Even if you see the government communications, Matt Hancock frequently saying, when you get the call, get your jab. So shouldn't it be, if you would like the vaccination, these are the available centres, and if you'd like to get it and it's right for you, go along and get it. There's no like thinking about it, it's just go and get your jab.
Yeah, and I guess, I mean, this is a slightly wider question. You know, other people in society will see this kind of pressure and they will kind of mimic that. I think we're seeing this kind of pressure now, you know, being mimicked by people on TV or journalists, people essentially saying, if you don't get this vaccine, you're a bad person, which is kind of mimicking a little bit the, you know, the messaging here. So this thing has the potential to snowball, right? That people get more and more annoyed by individuals exercising their informed consent and saying no. That becomes unacceptable at a society level if this messaging keeps going out.
Yeah, well, there's this splitting occurring. So they're trying to create vaccinated and unvaccinated. And that if you're the unvaccinated, the vaccinated people should shame the unvaccinated people. Stay away from them. I mean, you see media polls, you know, I think was it one of the breakfast shows, you know, should you unfriend the unvaccinated? You know, I mean, it's incredible. It's absolutely appalling. And the thing is as well, what they're also playing in is that psychologically it's safer to be part of a main group, okay? Because you're with more people, that feels safer. So they're trying to sort of paint that picture as well, is that you'll be safer in this big group, okay? So that's a kind of another psychological nudge that they're using to try to influence people. And, you know, I think even in Parliament the other day, you know, Matt Hancock was alluding to that, you know, if people are in hospital, if people have been vaccinated and you've got people who haven't been vaccinated, there should be priority of care for people who have been vaccinated. You know, so, and I've heard lots of stories as well about people being refused treatment because of not having had the vaccination, okay? So, you know, this is, as you said, it's got the possibility of snowballing to something very problematic, something very dangerous, and something very unethical that's going to be far more wide-reaching. And so this needs to be thought about carefully, because psychologically it is having a big impact on society.
Yeah, I guess there's no signs of any slowdown. It looks like they're sort of doubling down, because I haven't looked at the rates of vaccination, but presumably they're getting to a sort of a level where it's not going up as fast, and they seem to, there's no brakes on the system right now, and it just seems to be never ending, even though it's completely unethical.
Yeah. Well, I said to you earlier, didn't I, that it's very blatant now, but I think they just don't care. They will communicate in any inappropriate or unethical way that they like, and you know that they're armed with, you know, behavioural science in terms of trying to influence people. It seems that certain media outlets are also kind of backing up the government and pushing that. So the power of media is also playing a very significant role in all of this. But you're right, I think the pressure is absolutely relentless. Like I said earlier, it's, you know, people who haven't yet had the vaccination, letter after letter after letter after letter, text message after text message after text message. And then you get some of these media outlets starting these polls. And then, as I said, we're starting to see this kind of, you know, intergroup opposition where, you know, you've got these two camps, and the government and other sort of organisations are absolutely fostering this as best as they possibly can, because of course what they want is for everyone to get vaccinated, okay? But people's decisions should be respected, and there might be, for whatever reason, is that certain people do not want to get vaccinated, and that should be accepted.
Yeah, and I guess if they're using these techniques now for this, and they get them to work, potentially you can then, I mean, I think you used the word propaganda earlier on, you know, this is totalitarian kind of population management. You use these techniques to get people to do whatever it is those in power want done, basically. Is that?
Yeah, yeah. I mean, essentially, the behavioural scientists within the government are there to advise the government to try to ensure that the public are compliant with what they want them to do. And you're absolutely right. It's, you know, could this kind of move into other areas where, you know, people are controlled in other ways, and, you know, the basic kind of human rights and the basic civil liberties are not allowed, and at every turn, you know, people are controlled, and they're not allowed sort of access to basic freedoms. You know, I mean, it's incredible, really, isn't it? You know, with regards to all the restrictions that have been in place, and you know, initially telling us that we couldn't leave the house for more than an hour a day. I mean, it's I've never seen anything like it, and the influence that gets spread psychologically is quite incredible. And the behavioural scientists, they have done a very good job at ensuring that the public is scared, because the fear rhetoric has been pushed, and it's seen everywhere in terms of the adverts and the communications. And they've done a good job at scaring the public, you know. And I see that personally and professionally with the work that I do, in terms of, you know, people are extremely distressed by some of what's happened, and you know, and this is kind of unethical and completely inappropriate. And I think in terms of, sometimes people will ask me, okay, so you've highlighted some of the difficulties which are occurring. What do you think will help? Okay, and I think it's important to communicate some of that. And I think that the messaging and the communications need to be done in a much more balanced and a much more compassionate way. Okay, so whether it be around, you know, lockdowns, restrictive measures, vaccine uptake, or mask wearing, or any other kind of element of COVID strategy or other kind of government strategy, it needs to be, the frequency of messaging needs to be much reduced. Okay, it needs to be more balanced in terms of evidence, sort of for both sides of an argument. It needs to be done in a calm and compassionate way. Okay, so I think that absolutely needs to be fostered and developed, a different communication style. You know, we see on these freedom marches in London hundreds and hundreds of thousands voicing their opinions on what needs to be done. So I think we may see some change through kind of people power, you know, done in the right kind of legal and calm way. And there's a lot of good work being done sort of by various groups around the country and different individuals. So we have hope that we can do the right thing, and then we can make change and we can move forward more fruitfully.
Good. I think that's a good point to end, Hope, and to thank you as well for all the work that you've done to raise the issue of this suffering of people who have been denied their sort of basic psychological needs, and also to the HART group has done such a fantastic job producing all of that evidence. I can't thank you guys enough. It's really helped a lot, and
I think
keep at it.
Yeah, no, thank you. I mean, essentially, I'm fortunate to be health-wise in a good place, and I feel through my professional work, but outside of work, I've got a duty of care, and ethically, and for my own integrity, I have to speak up. I don't feel personally that I can sit back and watch some of what is happening and seeing people suffer. Is that I feel the need to speak up. And, you know, the work through HART as well, we've got a very dedicated team. And importantly as well, all of us work voluntarily. In fact, we pay our own admin costs. So we pay to run the organisation. and there's no conflicting interests either. So I think that's essential as well to point out. So we're essentially doing this, okay, to help people, okay, because we care, okay. So we've got a good, professional and dedicated team. But yeah, so I think the website details are on the slides, aren't they? And the COVID evidence booklet and the link to Pulse, which are our video podcast that we've made. I was in the first one, which is about some of which we've touched upon today, about sort of the psychological impact, particularly at the time it was around sort of lockdowns. But thank you very much for your time, Alex.
Thank you, Damian. It's been really interesting. I hope other people find it as interesting as I did. Okay.
Yeah,
thank you very much.
If people are interested in debate, you can find me on Twitter at Dr. DJ Wilde, so Wilde with an A. So for any kind of current updates and discussions. So yeah, thank you.
Okay, thank you. Best of luck.